Hello, hello, everyone. Welcome, welcome, welcome. I was just thinking about it as we were popping up. I'm like, I have two powerful, strong women with me. I love it. Feel the energy. We love a strong woman. Awesome. Well, welcome everyone. So today we have a very special topic, which we're going to announce in a second. But you are here at the IOCDF's virtual program. Live streaming came out of the pandemic originally as a way to provide community, but it has turned into so much more. And so I am always honored to share the stage with somebody who I think is one of the most incredible human beings. So I just always like seeing her. Let's back and Bill. Excited. So Liz and I, on our fourth Wednesday of every month, we have a lunch and learn. And this came out of Liz's programming. And what it really is it's for us to really dig a little bit deeper into a topic. We see all your questions or suggestions, and that's what we do for our Ask the Experts, but the lunch and learn is to really dig into a topic. And this topic is going to be relationship OCD. And the reason I'm glad that we're doing this is I think it's a subtype that I think some people are confused by. They don't really know much about it. It's newer, I guess. I mean, there's just a lot that comes out of it. And so this is going to be an incredible topic. So Liz and I are going to host it today. We're about to introduce our guests. But before we do that, we always have some opening words for you. First and foremost, this live stream is educational and is not intended to replace therapy. For treatment-related questions, please work with your provider or contact your local clinician. So obviously, Liz McAville and I are both clinicians. We treat OCD as well as Sheva. However, of course, there's IOCDF online resource directory, so you can find someone by you if you need a little bit more specialized care than that we can give on a live stream. So you can always go to the IOCDF's online resource directory at iocdf.org/find help. Also, the IOCDF is not a crisis hotline. If you are in a crisis or you are ever feeling suicidal or unsafe, please go to your local emergency room or call 911 or the suicide prevention hotline at 800-273-8255. Lastly, we want to create a safe space and be kind and respectful to everyone. At the end of the day, we are all here to support each and every one. A note that this is being broadcast on several social media platforms and is being recorded. So today we're going to be talking about relationship OCD. We'll dive in a little bit about what that is. But before we have to introduce the expert on our screen. So obviously this is Sheva Rajaee. Beautiful last name. So she is the founder, she's an MFT, and she's the founder and director of the Center for Anxiety and OCD in Irvine, California. She's my neighbor. Where she manages a team of clinicians specializing in the treatment of anxiety disorders and obsessive compulsive disorder. She recently authored the book Relationship OCD and has spoken about her own OCD journey in a 2017 TED Talk. She has appeared on CNN, been interviewed in Huffington Post, and has been featured on multiple episodes of the OCD Stories podcast, shout out to Stuart, and other anxiety and mental health podcasts. So Sheva, welcome. How are you doing this morning?
Oh, thank you so much for having me, Chris and Liz. It's an honor to be here, pleasure to be here. And I'm doing great, all things considered. I have a 8-week-old, and so today's a good morning. And you can see he's everyone's like, oh, you're in the nursery. I'm like, no, the nursery took over my office. So this is my new natural habitat.
Yes, so you and Liz both have babies.
Yay.
I was sitting here thinking, Sheva, okay, she's either in the nursery or I really love her background because it's so bright and it's so warm and friendly. So then I was like, I don't want to assume that's the nursery, but I love it. Well, good.
Thank you.
How are you feeling? 8 weeks in, this is an important topic for mental health. So are you doing okay and hanging in there?
Oh, wow. Absolutely. I mean, I'm doing okay. There's tons of ups and downs. It's like a lesson in letting go of expectation. And, there's sort of this urge inside me to sort of be like, all right, I'm going to figure this out. I'll read all the things. I'll optimize this. And then babies have this cool way of being like, that's funny. Here's a surprise.
You knew what to do. Yeah. Which is just this is life, right? This is what we talk about with OCD is the more we try to control and have total certainty, guess what? We don't get it anyway. So can we kind of let go? And what do you find, right? Even in this postpartum journey, hopefully you find that when you let go, there's some freedom. And that's what we're here to teach our patients too. So
yep. Babies are little life teachers, right? Like anything else. So we're hanging in there.
Good.
Well, that's
Well,
what, Liz and I had a discussion recently with Dr. Jonathan Grayson about like accepting uncertainty and living in that. And one thing I always tell clients is that there are going to be things in your life that no matter how much you try to control will not happen. And obviously I don't have a child yet, but having children, that's a big one. There is just no way that you are going to plot that route out, and you have to be able to be flexible. And that's what treatment is all about.
That's right.
Absolutely. Well said, Chris. For someone who doesn't have kids, you totally got it down.
Yeah.
You know what? I have a younger sister. She's about 12 years younger than me. And there was a
You were
period of
gonna
time.
say she's like your kid.
No. There was a time when my dad was going back to school, and I was living with him because I had just finished OCD treatment, and we have a different mom, and her mom was in the picture, and I was like taking care of her at 12. And from 12 to 18, and that was exhausting, and that wasn't my only child, so I can only understand. But there was so much uncertainty, just her getting sick, picking her up, taking her to the doctor's office, her waking up in the middle of the night crying about something. So I think after the talk, I was so re-energized by Liz and Jonathan Grayson's talk about accepting uncertainty, and it just shows up all over. And if we start to embrace it versus fear it, that's how we're going to manage this disorder. So we have so many fun people in the crowd. Thank you for everybody shouting out to Liz, to Sheva, and I. Maybe just to kick it off, Sheva, why don't, in your best way possible, let's just start from the basics. Like, what is relationship OCD?
Sure.
Yeah. Can we start? Sorry, Sheva, can you introduce yourself a little bit and what you do and your background just before we hop in?
Yeah, so Chris did kind of a great job with the textbook version of it, but so my name's Sheva Rajaee, and I think I like to start out, especially in this safe community, by saying, I have an OCD diagnosis. I've been pretty open and public about that, and relationship OCD is one of my most salient themes. It's kind of bounced around like it has for many of our clients, for many of us. So basically, my professional journey to becoming a clinician was really interlaced with sort of my own personal work, having seen a great talk therapist for years and kind of realizing that it was helping me so much with many parts of my life, but really wasn't addressing the sort of like repetitive, obsessive nature of my thinking. Everything sort of came together. I was working at the time, I got an internship at OCDLA there with Tom Corboy, and then at that same time started to recognize myself in my clients, which was this awesome kind of like synergy moment where I was like, wow, this is me, received a diagnosis, and then sort of went on over the next, 8 years or so to specialize and open up the Center for Anxiety and OCD down in Irvine, where now I get to work with my awesome colleagues, and we work with all anxiety disorders and have a little bit of a special emphasis on ROCD, which I'm happy to talk a little bit more about. But yeah, that's kind of the spiel.
Awesome. So hop into ROCD, and we have so many questions, and actually Chris and I talked last week a little bit about some of the things we want to be sure we get to today. So I know we'll hop into that, but if you want to just talk a little bit about what the presentation looks like and what often makes you say, oh, this sounds like relationship OCD versus maybe some interpersonal stuff or other things that people may be dealing with.
Totally. Absolutely. Yeah. Great question, Liz. So, first off, I think it's important to note, especially amongst this community, that ROCD is a theme. I think people sort of will call it a subtype, and if we're being very particular about the way that we're wording it, ROCD is a theme of obsessive compulsive disorder. The same way HOCD or sexual orientation OCD would be a theme, POCD, harm OCD. So it's important to note, it's not a diagnosis, and I know many of our community members already know that, but it really is a thematic presentation of OCD. And the primary preoccupation here is going to be the rightness of a relationship. And that can be any relationship. So we do see ROCD showing up with your relationship with your pet, with your friends, could be sort of like almost a religious relationship type piece, like with God. But primarily, I would say overwhelmingly so, we see ROCD manifest as romantic relationship anxiety. And that can look like, do I love you enough? Is my relationship right? And it can also look like, do you love me enough? Am I in the, is there enough love in this relationship coming from that end to me? So that's primarily what we see. And I like to think about it as a concern with checking the temperature of the relationship to an excessive point. Of course, what do we mean by excessive? And that's a little bit where we go into having a disproportionate threat response. So stop me if I'm rambling a little bit, but Everybody has concerns about relationships. They're a little bit of a hot button topic. People like to talk about them. So one of the first things we'll say is, why would it be ROCD versus just a typical relationship concern? I think that's a really key place to start, because that's where we start in our assessment sessions as well, right? It's like, should we even be treating this like it's an anxiety disorder? And so the number one indicator I'm looking out for with that kind of assessment is essentially, is this individual in a fundamentally healthy, safe, respect-driven relationship, and they're having a level of threat response that is disproportionate to that reality. So that's really key, right? That's where we get in with the intrusive unwantedness of the thoughts. That's where it begins to fit the ego dystonic diagnostic criteria. And that's when we can start looking at a relationship issue as maybe an anxiety disorder issue, as opposed to just, I'm really incompatible with my partner and I know it, I'm in it for some other reason. That wouldn't be ego dystonic. So I'll pause there for a second, but I think that's a really key diagnostic factor that would then bring someone in for treatment with us, for example, at CAOCD.
I'll never forget, I was on a panel I was watching a panel rather with Dr. Grayson at the IOCF conference one year. And a man went up and he was talking about, he didn't know if he wanted to marry his fiance. And Dr. Grayson kind of made a joke and was like, well, glad she's not here. And he's like, actually, she's sitting right here. And he's like, when are you guys getting married? He's like, next weekend. And it's just, I think what is so insidious about ROCD is, like, you can see that these individuals do have something there. They would have to care for it. When somebody comes in, what does the treatment start to look like? I mean, because what happens is there's a real basis there. People, I think that's why, you were just clarifying, like, there are times that people have genuine questions about the relationship. Like, how can you, does the treatment work to help somebody move through those discomforts?
Yeah. So, and, I think like many of the presentations that we might see in our work, it's usually not exactly cut and dry. I think it's more rare that we see someone come in and it's like a very clean cut case. That's actually the minority. More often, you do have a person come in and there are some relationship incompatibilities, right? Nobody's perfect. Nobody's partnering with somebody perfect. And that's blended in with this kind of overactive threat response piece. And so you have to kind of help the person understand, look, fundamentally, all relationships, I sort of say, are like an 80-20. You're going to get 80% what you love about being with a person. And there's 20% that you sort of tolerate. I sort of like to say there's 20% that you hate but tolerate. And we have to balance that kind of relationship education piece, relationship normalization piece, along with our CBT work, our ACT work, and our ERP. So we're going to be doing all of our sort of main OCD strategies, but we're blending it in with, I think, quite frankly, like a relational education piece and sort of a, what we'd call in the world of therapy, like a narrative piece, understanding how absolutely the magnitude that romantic relationships have on our quality of life, but also how big of a deal finding the right one has become in our society. So that's a big piece that we have to understand if we're going to treat ROCD.
You made a good point about societal messaging. I mean, that always seems to kind of, infiltrate how the OCD might manifest. And so you're right. There are so many shows now, reality TV shows about finding the one and staying together. And so, there is such a black and white nature of OCD there, in relationship OCD. It's like, if the relationship isn't perfect, it should be over. It might be terrible. And so that messaging, mostly, people see those movies, or like a Nicholas Sparks film is what comes to mind. And if their relationship doesn't look like that, it's suddenly like, oh, maybe this isn't the right one.
Wait, that's not real life, Chris?
Right? People aren't going to cry for you in the middle of like a rainstorm and like beg and, the music in the background. Yeah.
That's a real letdown for people. I think we've come to believe that that's the norm. So it's not on us. It's not that everybody's naive out there. We've really been given the message that you should expect that in your relationship. And if you don't have it, you're settling, right? And there's a lot around this word of settling that comes up in ROCD. And I just want to say, I like this little shocker, but it's like, I'm a fan of the idea of settling, because I think there's a feeling of contentment to that word that I really like to take it back. Like, I'm like, yeah, let's settle in.
Yeah. And I think, one thing I want to talk about is that, so what we find is that this is when OCD attacks relationships, right? And what do we know? Well, we know that OCD, for those of us that live with OCD, it tends to attack or impact the things that are most important to us, right? So it also makes sense that like we're in this relationship and OCD is going to attack it, right? The doubting disease is going to start giving doubt. What's important is kind of there's this mix, right, of like real life events, which we talk about like these like real life OCD and OCD, in the sense that like in any relationship inherently there's doubt. In any relationship you're never 100% certain, right? You like you said, maybe you're settling because there's going to be some settling that happens. Like there's no such thing as being in a relationship where there's no compromise or no settling on anything, right? But it's okay, what is the bigger picture and the bigger message, and what do I want, what do I look for, where OCD is going to try to attack that, because as we know, OCD doesn't like any uncertainty, right? So a normal amount of uncertainty OCD is not okay with. I guess one of the things I want to talk for a second about, because I promised viewers last week we would talk about this, is Sheva, one of the things I do see is there are times when when individuals might have OCD in different arenas as well, and some relationship OCD, but then some other things that could be like interpersonal stuff going on, or maybe even past trauma from relationships or different things that gets brought up that we're quick to like label it all as our OCD. And we talked last week about how this can be really detrimental, because then we may not be getting the treatment we need for what that is, right? Like maybe there is some ROCD, maybe there's contamination OCD, but maybe there's also some other stuff going on that maybe DBT skills would better serve that individual, not that individual altogether necessarily, but like that issue or that struggle that's going on, or if it's PTSD, maybe CPT or prolonged exposure therapy is going to better serve. And we were talking a lot last week of how we really want to be careful that we don't just treat everything as OCD. Just like if you have PTSD, but OCD as well, you wouldn't want to treat everything as PTSD, right? You want to say like, what is what, and what's the best evidence-based intervention for this, for whatever you're struggling with. And sometimes that's more than one intervention. How do you tease apart when, okay, like, I get why this might sound like relationship OCD, but here's some things that I'm hearing that might make me say, I'm not totally sure that it fits within that category.
Yeah, such a good point. I'm so glad even hearing you say that, Liz, that y'all were talking about something like that last week, maybe not vis-a-vis relationship OCD in particular, but it sounds like you were talking about it more broadly. And I think that is like in and of itself, that's such a great point, that when we're treating OCD or anything, I think as clinicians, we can get a little bit stuck and rigid in our own orientations or maybe our own strategies and sort of try and make everything fit the box. But a little bit to what we were talking about earlier, this idea that people come in and they're complex, and it's often that we see a person who could benefit from a little bit of EMDR to work with this piece. And then, OCD work here, and a little bit of talk therapy or grief work here. And sometimes that's encompassed in one clinician. I think that's a little bit of a super clinician, but sometimes that's encompassed in a clinician. And frequently we need to make referrals or collaborate. So I just want to say, I love that point is being made. I just don't think people come to us in sort of these nice segmented boxes of like, this is just OCD and this is all you get to deal with. It's impossible. And I personally don't like to work that way. And I try to encourage my staff to work very holistically as well. But let me get a little more specific. I think about it sometimes as like an iceberg. And so what I mean when I say that is that specifically with ROCD, but I think this can apply across the board, you will oftentimes see that as the big presenting problem. A client will come in and there's a lot of obsessions and compulsions. There's a ton of avoidance in their relationship. There can be sexual avoidance of commitment, intimacy, a big sort of showy OCD presentation off the bat. And then actually when you sort of look into this client's presentation, you're seeing an attachment injury. So a lot of it could be, for example, that, we had an abandonment that happened when the client was younger, a parent left, was absentee, was over controlling, whatever it may be. But you end up with essentially a relational instability at the base. And so what you're seeing is underneath the surface, there's an attachment wound, right? There's a trauma at play. And then maybe further up the ranks, you're seeing this ROCD that shows up, which is essentially, I like to talk about it as sort of this compulsive way to manage vulnerability, right? Like, we don't want to be hurt. We don't want to be disappointed. We don't want to be wrong. We don't want to experience regret. And that stands in and of itself. But think about how much extra power that has if it's fueled by an attachment insecurity too. In some ways, it is real event, right, Liz? Like, it's kind of this idea of like, no, but that did happen to me and that could happen again. And how much more power that brings to your avoidance, to your attempt to control and manage when you have that history. So to do treatment, now I'll talk specifically ROCD, but I really believe this applies across the board. To do treatment just on the top part of the iceberg, right? If you're missing this piece, you're not doing it comprehensively.
Right. Right. And so how do you do the bottom piece? What does that look like? Because that's not going to look like traditional ERP.
Yeah, absolutely. So what I like to do personally, and this is to my level of competency. So disclaimer, there's always a point where I go, you know what, this work is beyond what we do here. Sure. We are OCD specialists at the end of the day, but we're trained as generalists. You know, all therapists go to therapy school. So we do have a lot of experience working in sort of a more traditional general background. So what I would do for that is lace them together. Can the person understand, here's where your wound was. For example, your parent left. You have this pretty big fear of abandonment and loss and grief. And then that is manifesting for you, right? That's coming up in this complex psychological defense system, which is your OCD, your ROCD. So they're related, they're linked. And if the client can see the relationship between them, we oftentimes get really powerful results because you're saying, look, your wound is totally real and valid, but the way this is manifesting now is the disproportionate threat response. It is likely that not everyone will abandon you, right? It is likely that not all relationships are going to be inconsistent or smothering or whatever it may be. So we link the two together, and you're essentially doing a little bit of talk therapy work, trauma work, and you're linking that with your now let's do exposures around it. And I like to think about ERP sometimes for trauma in a way that when you are risking intimacy and vulnerability with your partner, for example, you're also teaching yourself that does not have to be dangerous. So it can be powerful all the way through the iceberg.
What I wanted to add to this conversation is, one of the things that I see a lot, and it can go both ways, is where somebody who has borderline personality disorder is absolutely convinced it's relationship OCD, or vice versa. Like somebody that's been diagnosed with borderline personality disorder doesn't have any of the other criteria of the disorder except that abandonment piece. And then they've received, DBT treatment, which may help with some emotional regulation, et cetera, but they don't feel like it ever helps because it isn't something that they organically feel. There's some ego dystonic there where they're like, but I know that my partner won't abandon me, but for some reason I am so fearful of that. So I would say of all the diagnosis, the misdiagnosis for that one, that's what I kind of see. So how can somebody tell the difference so they aren't going to the right clinician and getting improper care? Because somebody with borderline personality disorder shouldn't be doing ERP for OCD, and vice versa. Somebody who has OCD around relationships shouldn't be doing DBT for the OCD.
Yeah. I mean, I think the burden, correct me if you guys feel like this isn't the case, but I feel like a lot of the burden of that falls on the clinician. People are coming to us and they're asking us to check, sort of like look in, like pop in, see what's going on. And I think that if we are sort of ethical and we stick to our levels of competency, what I might do, for example, Chris, is like I might start a course of treatment and I'm going to see how it goes. I can't guarantee someone off the bat, I know this is 100% going to work for you. I 100% know this is OCD. I'm moving forward with an idea of what I think could be going on. And we're running an experiment. I know that sounds maybe a little nerve-wracking, right? But in a way it is. And we're going to try to put pressure on certain areas of a client's psychology and see what moves and see what doesn't. And if consistently I'm coming up against a block, I would be considering a different diagnosis.
What I was going to say is since we all specialize in OCD, for me, when I'm in a room with somebody and it just isn't feeling right, like, we see so many clients every single day with OCD, we live with it. And it almost feels like this language with my client that we both understand. But when I've worked with someone that has come in because they were diagnosed with ROCD and there was a lot of other stuff going on, there's really like erratic behavior, there's such a fear of abandonment, there's past history of trauma, they're doing harmful behaviors to themselves, a lot of suicidal ideation, self-harm, they're misusing drugs and sex and all that. I'm thinking, wait a second, I've worked with ROCD now forever and I have it, and this is nothing like what we've seen. So I do believe it's on the clinician, and it's important for people, like you said, to seek out a specialist who can see in those first couple sessions, wait a second, here's some other things going on. And I think it's a better fit for that. If you're showing all of that criteria, maybe you do have borderline personality disorder versus ROCD. If you have a history of OCD and now it's kind of moved because you're in a new relationship, it's much more likely that that is the diagnosis, and feeling more comfortable with that.
One of the things you said, Sheva, is that if you're not if you're not moving the needle and it's not working, that like there comes a point where you're kind of like, okay, this is ROCD and we're treating it as so, and we're seeing progress, versus like, this is outside of our scope of practice, or ERP isn't going to work. Let's talk for a second about what that looks like. So what would make you say this isn't working? But then more importantly, what I want us to spend more time on is, for those of us or those listening with ROCD, what should they expect from treatment? What does the treatment process look like? And what sort of freedom or relief can they hope to be able to gain?
It's such a good point. I mean, it's such a good question, Liz, because it's that big question, like a weighted question around like, what does it mean for treatment to work in a way? So it's pretty hefty. I'm going to try and be very careful about my response on that, because I can imagine a lot of listeners maybe getting a little stirred up over this and worrying about if their treatment is working and that kind of thing. And so I want to just put a disclaimer out there. That's a hugely complex, subjective piece, like what's working for you as a client, what's working for you as a therapist, that kind of thing. So what I'm going to say is also needs to be sort of like heavily subjectified. But I like to think about it as a person coming in, and they're coming in and, we're treating them for ROCD. We're going to be seeing them moving towards more ease and tolerance, with vulnerability. And I say that kind of generally, with vulnerability, with tolerating proximity, with tolerating connection. So when I see that my strategies, if I'm applying cognitive restructuring, if we're doing acceptance and commitment work, if we're doing exposures, I'm asking you to text your partner, I love you, every couple of days, to plan a date night, to initiate intimacy, something like that. And what's happening is I'm actually seeing that person go, oh, okay, I kind of pushed past the fear wall. And now I am actually experiencing, maybe after a short spike, I am experiencing a feeling of it's more ego syntonic. It's more aligned. I feel better. That is usually a very good indicator to me that we're moving in the right direction. And I'm going to kind of keep going. But if that process falters, right, I'm going to be looking at other things. Am I doing something unhelpful? Am I missing something about this client's presentation? Not that always means it's not OCD, right? And like Chris is saying, not that even means that OCD isn't there, but maybe there's some piece of the puzzle that needs to be addressed first. And can I address it? Am I capable of addressing it, or do I need to look elsewhere? But I am really looking, Liz, to have a client move more towards an aligned experience of being in their relationship, to where they're able to be in the relationship that they want, right? Because we are operating on the assumption that they want to be in this. And so if I'm seeing more of that show up, I'm feeling good.
How would, when somebody, a relationship, to most of us, we think of it as a mostly positive experience. But what I'll see sometimes is somebody who has pretty much strictly our OCD is really the only OCD they experience. And when they're not in a relationship, they'll feel like they're on vacation. They're like, I don't have to worry about a relationship. I don't have to stress out. This is so great. And obviously, it's that what I love about ACT is really trying to get somebody to values and say, look, what could a relationship offer that it currently isn't, you aren't currently experiencing because you're staying out of a relationship. But those people that are just constantly, when they're in a relationship, in that doubt, that OCD cycle, and just find it miserable, how do you move towards someone who, it's like, hey, I get it that you're kind of on an OCD vacation. You don't feel really triggered right now. And you feel like, oh my God, my OCD is cured because I don't have to deal with it until I'm in a relationship. Whereas somebody, with hit and run driving, the likelihood that you cannot drive, I mean, at least here in California, it just can't happen. So most subtypes, you can't just avoid the trigger. In ROCD, you can. So how do you talk to someone who's like, hey, it's been a nice vacation being single. I don't want to go back to having to suffer if I go into a relationship?
Yeah, oh, absolutely. The OCD vacation that you can get when you break up or whatever it is, and how confusing that is as well, because it seems to confirm the idea that you were in the wrong relationship, right?
Yeah.
It's like, well, I broke up with them and I feel great. And so it's confusing because you sort of like, of course you do. We've removed your stressor. We've removed this huge trigger that you were living with every day or you were engaging with every day. And I think even before I get into the specifics of that great question, Chris, it's like recognizing that when you're in a committed relationship, that's like 24/7 triggers. So just to sort of honor for anyone who's listening, like the magnitude of living with your trigger 24/7, where maybe you could not drive or whatever it is, or you don't have to go and face the spider or whatever you're looking for. But to your question, like, which is a really good one, and I think you alluded to it, Chris, like let me say this. Most of the time, our clients coming in with ROCD, they really want connection. They really, in their bones, want a healthy relationship. They want to be connected, right? And we could argue that that's a human need, but I think that ROCD oftentimes, like Liz was saying, we know this, it attaches to the things that we value the most. So sometimes my ROCDers, they're like hopeless romantic types. They really have this vision of healthy love, of true love, whatever that may be. So I find that those ROCD vacations, those OCD vacations are kind of short-lived because inevitably after a little bit, somebody's like, oh, but I really want the connection. And I really want what I'm originally feeling. Like I want to go for it. And maybe they're back in the game again, right? Or you can utilize that to show the client, hey, this is clearly a value of yours to your ACT piece there. Like this is clearly something you want. And if it is something you want, it's going to be worth the suck. Like it's just going to be worth it to push through, to work through, and get to the other side of that, whatever that looks like for the person.
Yeah, I know, like you said, I mean, most people want that connection, and so inevitably they're going to want to return to it. Quickly, what are some of the common triggers or compulsions that you see? So, for instance, I know a lot of times when people are getting married with ROCD, and people are like, does it feel like it's the one? Things like that, or checking text messages. Like, what are some of the predominant things that maybe if somebody's viewing this and they're not sure if they have ROCD, or maybe they aren't as aware of how the ROCD shows up? What are some like triggers and compulsions that typically you see in ROCD?
Sure. So some of your common ones are going to be, we could see a lot of reassurance seeking. So this is a person who might go to their family members and their friends. Hey, what do you think? Do you think they're right for me? Do you think we look like a good couple? Do you think we're compatible? And not just your typical like friend chat, because I think, again, that's where it gets confusing. We do that. That's a social thing that we all do, is to say, hey, this is our relationship, but to an excessive degree, right? To a sort of compulsive degree. Are you checking on the rightness of your relationship? And that can be with your friends and family. I think a lot of ROCD, you have to tune into that temperature checking internally. How do I feel, right? Like when I see you, how do I feel? When we're intimate, how do I feel? When I'm kissing you, how do I feel? How did I feel in my past relationship? So a lot of this, how am I feeling right now? Temperature check. That's a really big indicator. And again, compulsively, some of that is completely typical. A lot of that is paralyzing. Avoidance. So this can manifest a bit like a commitment phobic presentation. So this person might bounce a lot or stay in low stakes relationships. Low stakes relationships are not necessarily not emotional relationships, but they're typically relationships where the threat of vulnerability is less. So interestingly, if I know I want children and I'm dating somebody who has 3 children already and does not want any more kids, that might be a very loving relationship, but I could psychologically perceive that as safe because there's no chance it's actually going to go anywhere for me. Avoidance of lots of things. Yeah. Committed gestures. Intimacy is huge. I don't think we talk enough about that, but the way ROCD hugely impacts your sex life, your sex drive, your ability to be connected sexually. I could go on and on.
And using sex sometimes as a compulsion. Clients will come in and say, I didn't even want to, but I initiated it because I needed reassurance that my partner still finds me attractive, or my partner still loves me. And if they said no, then I'm suddenly questioning like what's wrong, and completely throwing out the window, like, their partner just went on a 3-day quick trip for work, and they come back at 2 a.m, and it's like completely negating that, but it has to be because we're no longer attracted to each other. So sex and intimacy, love, affection, all those things sometimes can actually turn into compulsions, and people can use those in a reassurance method, and it can impact it. Or being afraid to do it because, oh, if it doesn't go as good as last time, maybe the relationship is starting to die out. And so it just kind of like crawls into every aspect of a relationship.
Yeah, I mean, and even hearing you speak about it, Chris, too, just to validate for our clients and anyone listening, things that are very much normalized in terms of checking a relationship, chatting with our friends about a relationship, looking at quizzes online. Like, these are kind of the fun things we do in a relationship, right? When does that cross the boundary of now becoming compulsive and excessive? So just want to kind of honor for clients, it can be confusing.
Well, you made a good point, like for fun. I mean, it's always funny. The way that I can always tune into what OCD is not is none of my friends have OCD. I mean, I have friends that have OCD, but like my friends outside of, this world. And
Aren't I your friend?
Yes, I know. You,
Thanks,
Ethan,
Chris. I'm just kidding.
no, you, Ethan, Katie, I love all of you. My friends in my life that don't have OCD, it's so different. Like, I know we're talking about our OCD, so I'll go there. And it's just like, they don't constantly question. That's the bigger thing I see between my clients, or when I, really struggled, or people without. It's like they do genuinely have thoughts about the relationship, but it isn't this constant, like, I have to check in each day. I have to make sure, is it going well? Is it, I think of like in the movies when they have all these like pictures and like little string to things. I mean, there's such a constant over kind of focus on the relationship and the temperature checking that I just don't see in my friends that are married and in relationships without OCD.
Or at least they're not telling us if they're dealing with it. But I think the biggest thing here is like, it's the torment, right? It's the like, and that's the big piece is like, everybody has questions, whether it's a relationship, whether it's about your faith, whether it's harm OCD, like we all have thoughts, we all have intrusive thoughts, like that's normal. You have questions that might come up, but can you leave them unanswered and be okay with that? Or does that distress feel intolerable, right? The ability to not know for certain, does it feel intolerable, especially around things that you can't know for certain about, right? That's the big piece, is that what we're saying is that there is no total certainty in anything, but when it's OCD versus not is your ability to tolerate that, right? With OCD, we like can't tolerate we want total certainty. And so it becomes absolutely tormenting because you're trying to achieve something that isn't achievable versus being able to be okay with it and leaving it unknown, right? And the way I dealt with relationship OCD growing up was it was a lot of anxiety and focus for me on whether or not I had done something inappropriate. So it was, and whether you want to call it relationship OCD or moral OCD, right? It's kind of interesting, but it was like if I talked to a male who I thought was attractive, I would go confess to my significant other and say, like, I did this today. Does that mean I cheated on you? Are you upset with me? Right? Or I would disclose it to my mom or to other people. And if I had this thought about someone else, did that mean I did something wrong? And I call it relationship OCD because it was centered on like, because I was in a relationship, I felt like I had to tell them that. I wouldn't have those same triggers if I wasn't in a relationship. But again, it's tied up in moral, right? But it's kind of like, what is it? But very clearly an OCD presentation that we can target appropriately and did with ERP. But it was that inability to tolerate the uncertainty. And the uncertainty wasn't just, did I do something wrong? It's, well, are they going to be upset with me? What are they going to think of me? Right? Like all those fears that you have to get to and target the core of those as well.
Oh, that's just such a good point. I just have to say, like, the ways in which it's not just about, is my relationship right, but like, did I hurt them in this moment? Yeah. Like, can they tolerate my complexity? Like, I mean, all the questions we have in a relationship anyway, magnified through the lens of OCD. So super beautifully said.
Perfect. So Chris, you want to hop into questions?
Yeah, so we had some pre-submitted, and then we can jump into some live. So the first one comes from Dayton, and Dayton, we told him to come to the live stream because he asked this question last week. We're like, come back next week. So Dayton says, when he first met his partner and he first saw her, they're now in a relationship. They are matching really, really well. But back when he first saw her, he directly thought, this isn't my type. So she isn't my type. So it seems like that thought that when I first met her, she wasn't my type is kind of haunting the relationship now, even though he's saying like, I really like her. We match really well. Is this ROCD, or is she just not the right partner for me? Or how does someone tell that?
Yeah, really common, Dayton, like a super, super common thing is you meet somebody who's not your type, right? And I think I think this is a broad conversation. So we have this idea that we have to have perfect attraction in order to have a successful relationship. If they're not my type, then that's insurmountable, right? And I think the reality, if we're going to pull the relational piece here for a second, is that that's not the case, that attraction is complex. There's physical attraction, there's emotional attraction, there's intellectual attraction, there's attraction that grows, right? So it's actually not that remarkable that you met somebody who maybe wasn't your type, but you've been attracted to them in different ways. Where it becomes the OCD, or where someone would assess for if there's OCD in there, to Liz's point, right, really beautifully said, is can you tolerate that? Can that become a lesser important issue, right? As long as it is within your value system. So if you happen to come out and say, you know what, the type, the physical attraction is my 10 out of 10, it's gotta be there, then maybe not, right? Maybe that's egosyntonic for you. But if you happen to be a person who's like, you know, I actually really value the intellectual connection, I really value somebody who is a caring person, a good listener, respectful, whatever it may be. Those are my top values. And I would love it if they happen to also look like Oscar Isaac or whatever it is. Might have just given something away about myself there, but that is then that's fine. And that actually is a lower value for you, right? You come around and say, no, physical attraction is the most important thing, then I would look at that differently.
Thank you. The next question we got, we touched on it a little bit, but how trauma can impact like relationship OCD. So how can you navigate that, in a relationship if somebody has a trauma background and they have relationship OCD?
Absolutely. I'm thinking about that on our end and also our partner's end, and how much that can also, their trauma, our trauma, can all intertwine. And that's the complexity of a relationship and why they can be difficult. I just want to sort of back this with research. Guy Doron has done research and found that attachment insecurities are related to an ROCD presentation in particular. I believe he's expanding that study to look at how attachment insecurities impact all OCD. They have found a relationship between early childhood attachment wounds and ROCD as the presentation. So that's very common. I just want to reiterate, Chris, that's a common presentation. How can you manage it? Being open to treatment, being open to self-reflection, being open to apologizing when you've hurt your partner, being aware. I mean, there's so many ways I could look at that response, but I think I want to normalize it. It's actually common, if not likely, that you're going to have some attachment piece related in there, some fear, and you have to hold and honor that original wound as you're also recognizing that protecting that is no longer serving you. It is not getting you the relationship that you want. It's not getting you the commitment that you want.
Well said. We had a question at 12:23 your time, Skyla, from Eric B. How does perfectionism in a relationship, so a relationship not feeling like perfect, how does that play into the ROCD?
Yeah. Wow. I mean, hugely so. So in my book, I talk about the sort of narrative piece of the myth of the one, which is our cultural standard, our cultural perfectionistic view of relationships, which basically we all know it. It's very intuitive for us. They need to be perfectly aligned. Our relationship needs to be transcendent. It needs to click on all levels, and how damaging that is. And I also think I want to look at this question too from a more general OCD angle, which is that we can look at all compulsive behavior. We can conceptualize compulsive behavior as this fundamental desire to want to cleanse, right? So not looking at it as, oh, there's dirt, I have to clean it, but even big picture, right? There's some itch I need to scratch. The relationship doesn't feel right. Let me pick at it. Let me kind of wipe it, right? I'm not sure if I'm a good person. Let me purify. So there's this theme, there's this fundamental core to OCD that is kind of about, can I perfect this? Can I get this to a place where I don't feel discomfort anymore, right? And when you look at it, that big picture, that's an impossible task for anything, whether it's to keep a surface clean forever or to keep your thoughts about your partner perfectly clean, to feel perfect about them, to feel perfect about our morality. I mean, the list goes on and on, but you see that there's almost this desire fundamentally to like escape being human, and that's not possible. Can't do it.
No.
Stop
We've
trying.
tried.
We all have. Yeah.
Yeah.
So I have a question I actually was just thinking about clinically is, do you ever see relationship OCD actually present as disgust or contamination OCD? So what I mean by that is that as you were speaking, I was just thinking about, well, like I wonder sometimes if certain types of OCD could actually be better, I don't know the right word, but like better defined as other subtypes, but they're getting masked. Does that make sense? So like, could you, for example, like maybe you're engaging in, I don't know, disgust-based OCD because you're actually triggered of like, what will someone I love think about me? Or like, right. And like, so it's actually more about its relationship fears at the core fear, but it presents as contamination or disgust. But like, if we treat it like this, are we getting to the core? Do you ever see that? I was just thinking about that as you were talking about it.
It reminds me of your story, Liz, actually, where you were describing ROCD, but then there's also this really heavy kind of moral piece to it, which I see a lot in ROCD. Like those tend to tack on together. Sexual orientation would be another one that sort of tacks on pretty well. Absolutely. And that is because at its core, it's all the same thing. So I don't get super duper caught up on needing to find the exact right, is this your exact core fear or is that your exact core fear? Because if you dig under a person's core fear, which can be helpful, certainly, to be like, well, your core fear is being a bad person and my core fear is being suffocated emotionally or something like that. But underneath all of that, it's discomfort. So it can be super helpful to conceptualize, just like we use the categories of sexual orientation OCD and POCD and harm OCD to look one level deeper and go, well, what's your core fear within that? But to understand at its core, it's all about an avoidance of an emotional experience. So it's helpful to find those differences out. And also if you can't, you just keep pushing forward into discomfort. And I think you're still going to get good work done.
We have a good question I didn't even think about at 12:31. Well, I've thought about it, but not to bring it up. They ask, it's from Patricia, who says, talk about incorporating the partner into treatment. So with ROCD, how does that work? Is there couples work? Does the couple come in? How do you make sure it's not reassurance? Maybe touch on that.
Yeah, absolutely. I think there's a real lack of resource in our community for sort of couples and OCD informed couples work. Like, I feel like that is something that people want so often, is like, I have a couples issue, but I have OCD. Not even necessarily that I have ROCD, but I have a couples, it's just a couple that wants to come in as the primary client. And also the OCD is so significant that it needs to be understood by the clinician. I think there's a real lack. I'm not saying I'm here to fill it, but I do think it's necessary and it's a void. But to this great question by Patricia, ROCD in particular, I think is an excellent arena to invite a partner in, even if it's for a few sessions, even if it's for one session with your clinician, and have the clinician explain to the partner. Sometimes I even ask my client, would you mind if I spoke to the person alone? Would you mind if I had a session with them alone? As long as my client is comfortable. Have their partner come in and ask whatever they want. Ask the tough questions. Is this inheritable? Will my children have this? Does this mean they don't love me? Does this mean I should leave? And to be able to psychoeducate a partner on how this is an anxiety disorder manifesting. And this is comforting-ish, but like it wouldn't even be showing up if they didn't love you so very much. Wouldn't even be showing up in the first place. But that there's also a level of respect and work that is due to that partner, right? It's not, I have ROCD and that's this carte blanche to be a jerk to you all the time. Not at all, right? But it's like, I have ROCD. Hopefully that creates some empathy and some understanding, and also takes it off of you a bit, right? This isn't so much about you. It's what you trigger in me. It's what proximity triggers in me, what vulnerability triggers in me. And I absolutely think there is a space for the partner to join in treatment. It's not couples therapy, though. It's not couples therapy.
No, thank you for for that last sentence is important because I think sometimes people think that. This next question is near and dear to my heart because this is how ROCD manifested first before it attacked my very first relationship. But Christina asked at 1247 Skyla, and I'll sum up the question. What I see in my own practice at the Gateway Institute is a lot of younger individuals with ROCD. It doesn't always manifest in a relationship because they might not be in a relationship at that age. But this is how my OCD manifested. It seems like Christina's son. Can you talk a little bit about how ROCD can present around friends? Because that's how my ROCD first showed up. I mean, I had literally like wrote all my friends' names down. I'd come back from a party. Did we have a good experience? What do I have to do on Monday at school to make sure they're happy with me? Are they going to, there was a lot of that. So how does it manifest with friends? And is it any different in the treatment when it comes to friends versus a romantic relationship?
Yeah. And Chris, I might even lob this one back at you because to be honest, I mean, a lot of what I see are people coming in for romantic relationships. I have to say, when I've seen it show up with friends or pets or in a faith with your relationship to God, if you believe in God, it is so similar. It is almost not important to make huge distinctions, except to say that it can happen in these different ways. But it is about, I value this relationship. It matters to me what they think of me. It matters that this relationship feels good and, ensue compulsions. But I'm actually, since you had the experience of it, Chris, would you mind sharing a little bit of what it looked like for you?
Yeah, I would say some of the romantic stuff we've talked about, obviously that wasn't there, but I mean, I was so worried. I mean, she puts in the question like her son even doing things that aren't of his value just to make sure that the friends are happy. And I obviously know that for a teenager, we're going to be peer pressured. But now looking back on it, I mean, the things that I was willing to do for other people was inhuman. I mean, it was like completely against who I was. And Liz and I were kind of in the private chat, the ego dystonic versus syntonic. Like I was really doing things against my value system because I was so afraid of letting a friend down because the friendship was so important. And like if a friend was mad and didn't talk to me, it was so difficult to even concentrate on my schoolwork and on my tests. And like I said, my big thing is every night, I'd come back from a party and it was like I had to write down everybody that I needed to find out Monday and like have a final good conversation because they left the party and I didn't get to say goodbye. I mean, there was just such a focus on making sure that the relationship with my friends were strong. They were happy. They liked me. There was nothing wrong. And so when it translated into my first romantic relationship, my first like long-term relationship, it felt so similar, but this time obviously there were certain different ways it presented. It was presented around a relationship and the romantic component, but some of the similar things, like if I called somebody and they didn't call me back, are they over the friendship? Has our friendship fall apart? Worrying about upsetting them. But it made it to where my relationships around my friends were so important. And I've worked with someone who their ROCD was around their sister. Like when their sister got a boyfriend and stopped hanging out as much, it was like the focus on that. Or somebody who had a roommate and they were so close for a couple years and then they moved into a house bigger with other roommates and suddenly their relationship changed. And they're like, in this, the ego dystonic, it's like they're saying like, I don't care that a relationship has changed. I actually like it, but my brain can't stop. And that's how it was for me, is some of the friendships would die out and I didn't even like the friendships anyways. And I was good riddance to them. But my head was like, why aren't you guys friends? Why aren't you guys friends? Shouldn't you be friends? Shouldn't you have friends? Oh, you just saw that movie about people being friends since 2 and now they're each other's best man. Shouldn't you go back? And it was just like, but I don't want, and I think that's the struggle. It's like, I genuinely deep down didn't want to do the things, but I felt compelled because if not, I was so afraid that the anxiety and the stress and the uncertainty that would provide from not giving into the compulsion.
And I think in hearing you talk about it, what would make it, and I think you've perfectly accurately maybe self-diagnosed or word diagnosed, whatever it is, but the relationship is your concern there. Because if you see it sort of like jumps across different presentations, but you're constantly coming back to my relationship with this person, the way my relationship feels with this person. And I think that that's what would make you a bit more, kind of like more of a shoe-in for an ROCD type lens versus something like a morality piece there. So yeah, thank you for sharing that.
I'm going to do a couple of speed questions. At 12:49, Stacy asks, can somebody have one long-term subtype, so in this case, harm OCD, and can it then switch into ROCD? So can people's subtypes switch like that?
Of course, absolutely. There is no, it could switch day to day, week to week, month to month, year to year. There is absolutely no right or wrong to that. And again, if you think about it as OCD, as this fundamental desire to want to have completion or to have things be clean or purified, those are just masks. Those are just masks. So it's really not that important if it switches.
Another question was from Leanne on YouTube at 1250. She asked, does people always hound their partners for reassurance, or does it always present as asking people outside of the relationship for how the relationship is doing?
Both, Leanne. Both, D, all of the above. Yeah. Some people maybe feel more comfortable with it being like asking a friend or a parent, a family member. And some people are more primarily focused on checking with the partner, right? Even like what Liz was saying, it's like confessing to the partner. I found someone attractive. Is that okay? What does this mean? I usually see both.
And then another question from Love Lana on YouTube was, would this be considered ROCD? She obsesses about her sons, knowing that I love and value them equally as their mother. I fear from childhood history of being adopted, a family with 4 biological children. So as we were talking about maybe some things coming from the past, but can ROCD present like that, like really obsessed that somebody, knows that, hey, my kids love me equally and I'm afraid that they don't?
Absolutely, Lana. Absolutely. I mean, of course, it's not possible to sort of like diagnose in an environment like this, but actually the way Chris was describing friendships, and we focused on the relational concerns there, that he's concerned about essentially the temperature of the relationship. That's exactly what this is as well. So most certainly this could be relationship obsessions.
Yeah, no, and I think that's what's so hard with OCD is it's so complex. I mean, I do, you probably feel this way as well. It's like you could see 2 people with ROCD and it could present so differently. It can absolutely, because there's different natures to a relationship. There's different natures to a friendship and things like that. So, any final thoughts with ROCD? Let's say somebody's watching this and either are starting to say, wait a second, I may have that. I'm constantly questioning if I should be with my fiance, even though I love her, or, somebody who's saying like, hey, I don't know if I'm always being the right boyfriend and I obsess over my girlfriend, not thinking I'm good enough boyfriend for her, and these other kind of things. What should, some important message for someone that's either figuring it out or they have ROCD and know it and really are here to kind of get some help?
Mm-hmm. Yeah, I mean, I think it is to be, there's so many things I could say here, but I think one thing that might be very helpful, that I have found very helpful, is to really think about that there is no right manifestation of a good relationship. We are really oftentimes looking for this perfect relationship, this ideal feeling, where everything is aligned according to what society says it should look or feel like, or our friends say it should look and feel like, our culture, our faith background, whatever your programming may be. And to remember that the right relationship is the one that works for you and your partner. The right amount of connection, intimacy, the right, your friend might really want to be with somebody who's a hyper intellectual, and you might value emotional connection. And that doesn't mean that anyone's right or wrong. And I think we oftentimes are looking to get it right by having our relationships aligned to some standard of perfection. And we're missing the beautiful complexity of that unique pairing. So just to remember that the right relationship is the one that works for you and your partner. And that's totally okay if it doesn't happen to look like the movies or like your best friend's relationship.
I'm telling you, Nicholas Sparks has ruined ROCD for people.
It's like Disney, Nicholas Sparks, Taylor Swift is in there.
I always thought, like in Happily Ever After, do they just sit in the throne room in their castle and just stare at each other? Like, what do you do? Nobody would talk about it.
I also just want to say, I think this has been really helpful for me from a clinical perspective. I know for all of the patients who might live with those ROCD, it sounds like this has been really helpful and useful. But from a clinical perspective, I think it's been really helpful to think about too, just that reminder that we shouldn't always try to fit patients into a capsule, right? It's really about it's about conceptualizing and saying, like, at the end of the day, the treatment's very similar, right? So like OCD treatment for sure is very similar. If we're targeting uncertainty in the sense that, like, if the goal is I want to be certain, I need to know, I can't have any doubt, our treatment is to really help you learn how to tolerate uncertainty, how to tolerate distress, how to tolerate not knowing, and actually learn to be okay with it, right? Because it is inevitable in life, whether it's a relationship, your career, your faith, it doesn't matter, right? Anything that's important to you, there's going to be some doubt, there's going to be some uncertainty, and that can actually be an opportunity to grow. It doesn't have to be an opportunity for us to quit or distance ourselves. And what we want to make sure, I think across the board, the message I want to make sure we send, and then Sheva, I'd love to hear any wrap up thoughts you have also, is just that the biggest goal across the board that I always say is that I don't want OCD making the decisions. If you're leaving a relationship because it's time to leave a relationship, or you are entering a relationship because you want to be in that relationship, I want that to happen. But we don't want it to be that we're entering or leaving or paralyzed to move to the next step or afraid to commit because OCD is dictating that or anxiety is dictating that.
Totally. And if I could wrap with just even one, like I'm going to take that thought, Liz, and just my next thought on that piece, because that was so well worded, is, and sometimes you're going to make a mistake. Like, and sometimes you're going to look back and be like, whoops, like OCD did run the show there. Or I let my OCD ruin that relationship even. Like, I think plenty of the people listening are probably like, yeah, I've lost relationships to OCD. I say in my book, I have hurt my husband like plenty of times. There's been pain caused in my relationship because of my anxiety disorder. And it can feel really, you get very caught up in shame when you sit in that and you're like, God, like I suck because that was the case, or I should have known better, I should have caught it. That goes against the fundamental healing we're trying to advocate for here, which is we're human beings, we're going to mess it up. It's going to be messy. There's stuff we can't know or optimize or fix. So if we can go real deep and just say, like, let's accept that, let's accept the human condition is a messy one filled with suffering, then you're able to have a bit more compassion through this, like, understandably complicated life that we live. It's hard.
Absolutely. Well, yeah, thank you for that final message. You mentioned your book. Where can they find your book?
Absolutely.
If people want to learn more about RCD and really just found this talk valuable and wanted to continue and they like that reading modality, where can they go?
Absolutely. Yeah, it's available anywhere books are sold. All your major booksellers will have the book available. And it's also now on Audible as well if you your listeners are more interested in continuing to listen.
The title.
Okay, I'm going to get the full thing out for you guys. Relationship OCD, a CBT-based guide to move beyond obsessive doubt, anxiety, and fear of commitment in romantic relationships.
Awesome.
Well said.
Love it. Well, Sheva, it has been amazing. And I am just inspired that you're here 8 weeks postpartum. So congratulations on your little one. It has been so great, insightful for both me as an individual and certainly a professional. Chris?
Yeah, so just as a wrap up, thank you so much, Sheva. Obviously, if you're watching this and you want to share this with someone, the IOCDF puts this all up. You can access all of their live streams. Make sure to go to iocdf.org/live. You can always find out where to watch us and the latest talks. Also go to iocdf.org/peace of mind. That's where you're going to find, when we read those pre-submitted questions, you can submit your pre-submitted questions there. Also, somebody submitted that they wanted to talk on ROCD, so you can definitely submit something for future talks. A couple final things. Don't forget that OCD Southern California, we are an official affiliate of this organization, the IOCDF. We are having our big 6th annual virtual conference this Saturday, which means anyone from anywhere can attend. Liz McInvale will be there. I'm so excited to have her support.
Chris Johnson will be there speaking.
Yes, Ethan, Katie, some of the other live stream faces. We're gonna kind of recreate the magic we do on the live stream there. So make sure to join us. You can go to ocdsocal.org. That is where you can find out more information, including where to register. And registering, you can go to OCD SoCal Conference 2022.eventbrite.com. So we hope to see you there this Saturday. You can email us at info@ocdsocal.org. We have scholarship tickets available. A couple final things. Don't forget the IOCF is having their walks. Go to iocf.org/walk and you can find a walk near you. They're coming up. And then don't forget the 27th annual conference. You got to go to iocdf.org/OCDCon. And we're going to be in person. And I'm going to hug Liz because I haven't seen her in forever. So I'm so excited. So it's in Denver, Colorado. Make sure to come. You're also going to see on the IOCF website, the Faith and OCD Conference, May 9th. So there's a lot of really, really great things happening. Join the IOCDF community, meet others like you. And don't forget that on Tuesday, there is a town hall at 7 p.m. Eastern time on real event OCD and false memory. iocdf.org/peace of mind to submit pre-questions. Thank you so much, Sheva. thank you as always for everything that you provided for us today. And I'm going to give Liz the final word. She always has a sweet message to take us out. But don't forget, be back next Wednesday. Liz and I will be here for Ask the Experts.
Yeah, so just wanted to say thank you to everyone who joined. It sounds like so many people really resonated with this talk, and that a lot of you live with ROCD yourself or have experienced it. And so I am just so grateful, Sheva, for you, your expertise, and for our ability to take an hour of your time to help educate and hopefully inform. I think a lot of us, when we deal with subtypes that or themes that we may not fully understand or that feel a little bit different or we can get confused about, sometimes we wonder if ERP will work for us. But the message that's loud and clear is that treatment works, and help and hope always remain available. So thank y'all for joining, and we'll see you next week.